Hi, my name is Catherine Auman. I want to talk today about psychedelic psychotherapy, which is really up in people's awareness right now because of Michael Pollan's book, How to Change Your Mind. It's a big bestseller, and it's really time to talk about how psychedelics can help in healing. And this has actually been a topic that's been around since the 60s when Stan Grof was doing psychedelic research with LSD and actually finding that I was having very good results with people with intractable depression, anxiety, substance abuse problems, end of life issues, meaning of life issues, and so on. And then then prohibition started, and these substances were made illegal. As you may or may not know, psychedelic substances such as mushrooms and cactuses and different types of plant medicines have been around since the beginning of time. Most cultures have had some sort of shamanic practices where they were able to induce altered states, and then people were changed forever from having them. And so it's only been fairly recently that in the United States this was made illegal. And now there's been some studies that have been conducted legally that are showing very positive results. So in preparation for more of this happening, some of us have trained and have expertise in psychedelic integration, or what happens to people when they use substances for healing purposes. There are guides, there are people who've practiced shamanism, and then there are licensed professionals such as myself, who for years have been on lists such as the provider list for MAPS, which is the Multidisciplinary Association for Psychedelic Studies, and now a new one, Psychedelic Support. And why you might want to see a licensed therapist is that sometimes the use of psychedelics can be challenging for people that have issues such as depression, anxiety, very critical inner workings in their mind. And it's good to have a full psychological assessment before one goes for this type of treatment. So what I do with my patients are people who approach me, and I've had quite a lot since Michael Pollan's book has come out. We do a full psychological workup in the first session, full assessment, and then talk about whether or not this seems like it would be a good idea for the patient. And then, of course, as a licensed person, I cannot refer anyone to someone who's working illegally. And then upon return after the experience, as a licensed professional, I can help a person integrate that experience. How do you bring that into your life? What do you do now with that awareness? What kinds of new habits might you want to start? New different ways of thinking. How does this apply to my life in general? And this can be an ongoing process, or it can be a short process. One of my good friends credits psychedelics, psychotherapy, and certain types of coaching for turning his whole life around. And these things are not necessarily either or, but they're often used in conjunction for people to really have a better quality of life. My work here is to help people really have a better quality of life. If you have any questions, please don't hesitate to contact me either through my website, which is catherineauman.com, or you can always email me at info@catherineauman.com, and I am here to help you in whatever way I can. All right?